Hey everyone, it's Councilwoman Phylicia Porter here, and we're here to talk about a favorite topic of mine, Black maternal health. And I want to frame why this conversation is so important. If you have not been seeing the videos that are circulating through social media of Black women, regardless of socioeconomic status, regardless of region, state, all the things, they are experiencing some of the highest disparities in morbidity and mortality, meaning their sickness and their death rate as it relates to their pregnancy. And we're going to have a real conversation about what that looks like today. I sponsored a bill last year, the Black Maternal Health Agenda, which outlined how the city can really systematically work with hospital systems, work with initiatives like Be More Healthy Babies to really combat this issue. With Baltimore having a high number of African American women, this issue is not only close to home, but it also is impacting our public health and healthcare delivery systems. So as we go through this podcast today, like, share, and subscribe, but also let me know in the comments section. When folks think about maternal health, they just think about when the baby comes home or when the baby's at the hospital. We're going to be shaping this in a system of where that child and mother goes to the hospital, but also what that postpartum care looks like. Black women are often dismissed and ignored. When a woman is pregnant and that vulnerable moment, that is where we should be able to trust the system. And too often we have seen across this nation, they are not heard until it's too late. And oftentimes, Baltimore, women are dying because of the lack of access, the lack of being heard, the lack of being taken seriously. And so when we talk about health equity, we're not just talking about health equity, making sure that folks get the proper resources. We're talking about health equity in a space where they are getting the same resources and treatment as their counterparts, regardless of race, regardless of socioeconomic status. That is what I'm talking about when I talk about awareness and accountability. It's not just making sure people have the resources, it's making sure people have the same level of resources that all the other counterparts get. Because again, this is a life and death conversation for this mother. As she is ushering a life into this world, she is in her most vulnerable moment. You know, that partner is in their most vulnerable moment. And that is when we should be able to lean on and trust our healthcare systems to do the right thing for everyone. Pregnancy should not be a risk. Let me repeat that again. Pregnancy should not be a risk. When we're looking at the systems in Baltimore, the healthcare delivery system, community-based organizations, doula support, all the things that shape our maternal health system here in the city of Baltimore, it should not be a risk. As you are delivering your baby, you should not have risk, right? And so we're talking about rushed experiences. We're talking about dismissed concerns of pain. We're talking about delayed responses. That is all aspects of access to care that could potentially heighten your risk for pregnancy complications. I want to be very clear and mindful when I say this. Those differences have consequences. And let me say that one more time for the people in the back. Those differences have consequences. We're not talking about those consequences that we know with some of the high-risk pregnancies that some of our women go through. We are talking about preventable complications and also preventable deaths as well. Here's a quote that many people, they talk about and they use as a standard of how important this crisis is. 80% of deaths related to complications within pregnancy are preventable. We have so much within our system, within the city of Baltimore, that's related to the environment that our mothers, our fathers, and our children are living in, and that encompasses 80% of our health. Right? So 20% of our healthcare comes from our healthcare delivery systems, like going to the doctors, preventable wellness checks, all those things. That is 20%. The large portion of our healthcare comes from our environment, our access to care, our transportation, all of those social drivers of health that could make or break how your pregnancy is existing, how you are feeling during your pregnancy, the food that you're eating during your pregnancy, the housing that you have during your pregnancy. These are all the social drivers that take into account when we're looking at how this disparity is impacting Black and brown communities in Baltimore. So I want to ask you something, Baltimore. I want to ask the women in the room, have you ever been dismissed by a physician when you were talking about your pain? Have you ever felt unheard in a medical setting? As chair of the Public Health and Environment Committee, a public health scientist, I have even had those types of interactions with my healthcare provider and healthcare team. And it's so important that we have physicians, integrated medical care teams to include doulas and midwives, all of the people that make sure that that baby is born healthy. That is where we need to focus our energy with regard to making sure that we're connecting those people, but also connecting the resources that they bring to the table as well. What I really want you all to focus on, the access to care and making sure that you speak up during your health appointments as a mother, as a father, right? In those healthcare settings, speaking up and making sure that you are being seen and heard, but also Baltimore, how we are connecting it to larger government systems like the city of Baltimore and Be More Healthy Baby strategy. Remember when I talked about my role as city council person? As the legislative body, my role is to make laws.
Respect to the law.
We saw the vision from my Black maternal health agenda a year ago. We saw that happen in real time and how the city health department took that agenda and executed it within city agencies, particularly the city health department. So just to connect the dots for you all, the vision and law that was made by myself last year went to the executive branch, right? The mayor's agencies, the city health department. Remember I said if a law is being developed, an agency and a fiscal note has to be connected to it. The fiscal note is going to be within this FY27 budget that we're going to be discussing in the next couple of months, but it's also attached to an agency. So this is policy development in real life, taking it from an idea from Tanae. She brought the idea to me and she did that on the state level. We took it to the local level, set the vision, and now it has gone to the executive branch within the Baltimore City Health Department, has a fiscal note attached to it during the FY27 budget cycle. That's the whole policy pathway in real time. My friends and family personally have gone through some of these issues, being tagged on social media with some of these issues that are happening across the nation. But I want to tell you something. The Baltimore is leading on this issue. The strategy by Dr. Michelle Taylor and Be More Healthy Babies initiative at the Baltimore City Health Department is exactly doing what we are talking about. Shout out to Tanae, educated me on birth workers and really how our birth workers are standing in the gaps on some of those social determinants and drivers of health. We are doing the work in real time, and we're making sure that Black mothers and vulnerable mothers that are not being seen, not being heard, not being felt, being dismissed in real time are at the center of this policy and at the center of the public health and healthcare delivery work that we see here. We have world-renowned healthcare institutions in the city of Baltimore. I'm so grateful that we are here and we are connected. But there are other jurisdictions within the state of Maryland, our rural counties, Wycomico, Dorchester. They are not afforded those opportunities. And so Baltimore can be a leader in this space, solving those issues of access, lack of access, solving those issues of Medicaid and Medicaid reimbursement, and what that looks like not only for our physicians and nurse practitioners, but increased Medicaid reimbursement for our doula and birth workers and our midwives. We've got to see that we cannot keep allowing the system to fracture a community where lives are on the line, Baltimore. So thank you so much for joining me today. It is such an honor to talk about this issue as a person that has been at the forefront of this issue, not only just within my work on the city council, but in my professional career. It is an honor to lead this work here in the city of Baltimore and partner with the city health department, partner with our hospital institutions to make sure that we do not continue to be losing lives for preventable complications that happen during one of the most vulnerable points in a woman's life. Talk soon, Baltimore, and I look forward to seeing you all soon. Bye.